Hello, I am Dr. Shilpa Yadav, Senior Pediatric Consultant at Jehangir Hospital. Currently, I am the President of Pune IAP, and my areas of interest are adolescent medicine and infectious disease. First, we'll talk about children, babies who are born up to 1 month. So, we'll consider the period between 0 to 30 days. We'll start with once the baby is born and the mother has fed the baby. Many times the mother is tired, is listless. So sometimes if the baby is on the same bed as the mother after feeding, many times mishaps can occur, like the hand can fall on the baby's mouth or chest, which can smother the baby. If there are pillows which are very close to the baby's head, a newborn baby is not able to control the head. So if there is anything that is causing a blockage of the respiratory tract, the baby is not in a position to turn the head. So we have to be very careful when we make the baby sleep in a crib or along with the mother, that there are no soft objects like pillow casings or bed sheets which can smother the baby. Also, once the baby is fed, it's a good habit to inculcate that once the baby is fed, the baby has to be put in the crib and not on the same cot as the mother is sleeping, because the mother also needs some rest. And sometimes when you're extremely tired, you don't know where the position of your hand and leg is, and that can cause a lot of grievous problems. So in medical terms, this is called as sudden infant death syndrome or crib deaths. Now we'll discuss about accidents in children from the age group of 3 months to a year. So this is called as the infant age group. Now at 3 months, the baby is able to roll over. So whenever your baby is rolling over, don't keep the baby on a surface like a bed or a divan or a couch, where the baby can easily roll over and fall down. We have seen a lot of accidents occurring where there is head injury to the baby just because the baby has rolled over and come down. So this is about 3 months. Again, once the baby is able to roll over, if there are soft things lying on the bed like a cloth or soft toys, again there is a chance that the baby might get smothered. When the baby is crawling, small objects on the floor like peanuts or small detachable parts of toys. Many times we give toys unknowingly to the baby, where the baby puts the toy into the mouth or touches the wheels or small parts of the toy which can get detached and the baby can choke on this. So you have to be very careful as to what kind of toys you are keeping near the baby or any other furniture. So you have to be careful when you're planning your house, when a baby is coming in, that you should have rounded edges to your furniture so that the baby doesn't get injured. The baby climbs up onto a chair and falls down. So at all given times, these young infants have to be supervised. Secondly, the baby is crawling, can go into the kitchen, can go into areas like your washroom where there are tubs filled with water or buckets filled with water. We have seen another very important thing is your latches to the doors, which are at a level, if they are reachable to a child's hand, they might get locked inside, and it's a real panic situation for the parents when the child is locked inside and you cannot instruct the child to open the door. Now we'll talk about accidents in children between 1 to 2 years. So at this stage, what are the things that the parents should be very careful about is keeping boiled water, keeping hot food into containers which is reachable to the child. So we have a lot of children who come with parents were having tea, or there was a hot water kept for bathing, or there was something cooked and kept on the table and the child just pulls it. So there are a lot of burns injuries which happen during this age group, where the child comes running and just dashes into you and you spill hot water or hot curry onto the child. The mother or the grandmother or the grandfather is taking medicines for diabetes, is taking medicines for hypertension. So these tablets, if the child ingests, it's a disaster. Also, the medicines which are given for the child, they have to be kept in a closed cabin. Another very common mishap that occurs is cleaning detergents, like you wash your clothes, the washing powders, the liquid detergents that are kept, the phenol, the things that you use to clean the floors. All these are extremely toxic. Many times kerosene petrol is kept in bottles like Coca-Cola bottles or Fanta bottles, like this is the commonest thing that we store these things into. The child doesn't know that though the bottle is that of a cold drink, the contents are not cold. We'll discuss about children who are 5 years and above, or they are riding these bicycles and tricycles. Be very sure that your child is wearing a helmet, is wearing a knee guard, is wearing an ankle guard, or is wearing an elbow guard, because many times these children fall and they can sustain fractures. Secondly, the electrical panels in your house, if they are at a lower level, if they try to insert some things into the socket, they can get electrocuted. So you have to take care of all of these things when you're looking after young children. Thirdly, if there are glass panels on your balcony and children are left there for any reason or go out, there is always a chance that these glass panels can break and the children can fall down and sustain head injuries and fractures. So these are basic things that you need to keep a check. Last important thing that I would like to add here is when you give fruits, nuts, small cherries, these have to be strictly avoided or cut into small pieces and given, because a child can choke on these things if he is in a hurry or he's running while eating these things. Again, pointed objects like pencils, spoons that the child has when he is running around has to be strictly prohibited, or he's putting those things into the mouth when he's running, because serious complications can occur is they can pierce the throat and injure the carotid vessel which supplies the brain. So you have to be very, very, very cautious when you're giving playthings to the children in the form of spoons and pencils and pens. So these are not